Influx found out how the drugs can cross the biological barrier. The first and the less selective route is the paracellular route. This is relatively less selective, depending on the type of the epithelial cells or endothelial cells. The paracellular route sometimes opens wide, but sometimes totally impermeable, like in the blood-brain barrier. Either ion, hydrophilic, or lipophilic drug can go via the paracellular route, but cut off lies on the size of the drugs. The second route is transcellular pathways. This is done via passive diffusion. This pathway allows only lipophilic drugs to permeate. The driving force is concentration gradient. The third route is vesicular transport. Vesicular transport involves formation of vesicles. It can be endocytosis, exocytosis, and transcytosis. One way to direct the drugs to be transported via vesicles is by incorporating the drugs within negatively charged nanoparticles. This can be facilitated via adsorptive endocytosis. Some of the drugs require interaction with the receptor before being internalized to be able to enter the cells. Once in the vesicle, drugs can be released or recycled back to the surface. The easiest and least specific is the fluid-mediated transcytosis. This is like a pinocytosis and doesn't require charge or specific binding to the receptor. The fourth route to enter the cells is via an influx transporter. Influx transporter facilitated the entry of selective substances to the blood-brain barrier. Influx transporters present in the cells or in the biological barrier to minimize the entry of unwanted molecules that might harm the cell. Different from the influx transporter, there is another pump called Eflux transporter. This Eflux pump helps to remove the waste from the cells or from the organ to the blood vessels lumen or to the extracellular fluid. This happens with amyloid beta, which was removed from the brain using P-glycoprotein Eflux transporter. So, which route is appropriate for your drugs?